What Parkinson's symptoms qualify for SSDI? Imagine trying to work when your body feels like it's constantly fighting itself. If you have Parkinson's disease, certain symptoms can make it impossible to keep a job. The Social Security Administration looks at how Parkinson's affects your ability to do basic work activities. To qualify for Social Security disability insurance benefits, your symptoms need to be severe and persistent, even after you have tried prescribed treatments for at least 3 months. Specifically, the SSA considers 2 main criteria. The first is if you have disorganization of motor function into limbs, which could be your arms or legs. This means your movements are so impaired that you struggle to stand up from a seated position, keep your balance while walking or standing, or use your arms effectively for tasks like lifting or handling objects. If these motor issues cause you extreme difficulty in these areas, it could qualify you for benefits. The second criterion involves having a marked limitation in physical functioning combined with at least one other marked limitation in mental or cognitive areas. This could include trouble understanding or remembering information, difficulty interacting with others, problems concentrating or maintaining a steady pace, or challenges managing emotions and daily self-care. Parkinson's can affect movement and mental functions, and if these limitations prevent you from doing any work reliably, you may be eligible. Common symptoms that qualify include persistent tremors, muscle rigidity, slow movements known as bradykinesia, impaired gait and balance, speech difficulties, and cognitive decline. These symptoms can make it hard to perform tasks that require coordination, strength, or mental focus. To support your claim, detailed medical documentation is vital. This includes your diagnosis, treatment history, neurological exam results, imaging tests like MRIs, and reports on how your symptoms affect your daily life. Records of medications and side effects, as well as personal statements or witness accounts, can also strengthen your case. Even if your symptoms do not exactly match the official criteria, the SSA considers how your condition limits your ability to work. Because Parkinson's disease varies from person to person and tends to worsen over time, the focus is on your functional limitations rather than the diagnosis alone. If your initial application is denied, working with an SSDI attorney or advocate who understands neurological disabilities can help you navigate the appeals process. In summary, symptoms that qualify for SSDI are those that cause significant, ongoing impairments in movement and cognition, preventing you from performing essential work tasks despite treatment. These limitations must be severe enough to stop you from earning above the SSA's income threshold for substantial gainful activity. Always consult with your healthcare provider for personalized advice and thorough documentation to support your claim.